I mean, in the beginning, it was, of course, kind of legal gray area to do any medical care online. There was a lot of pushback or let's say resentment towards doing this kind of thing. The Kingdom has currently the largest virtual health care system in the world. So it's the virtual hospital, and that's in the Guinness Book of World Records actually, as the largest in the world. And they're doing a lot of good work as far as digital health. It's a platform that connects care providers with people who need access to mental health care. If you don't work hard, then you won't excel in life, right? So it's kind of a given that people have to push. They have to, they have to have grit.
Just the runner's high. The runner's high, yeah. It's amazing. It's like being on a cloud.
Exactly. And that's like similar to heroin, really.
It's addictive as well.
It is, yeah.
Once you start running, you can't stop. Do you believe that everyone should go to therapy?
Well, I would love that, but I don't think everyone needs therapy. Keep in mind, when you meet people socially, they don't really open up to you. Everyone has a facade. They have a kind of mask on.
Dr. Majid Al Desouki, welcome to Discussions.
Thank you.
No, thank you for joining us. I was really keen on having you here on the podcast. With Discussions, our aim is to bring people from different sectors that are creating such wonderful social impacts, such as you are in the field of psychiatry. You bring 20 years of experience working in the Kingdom as a psychiatrist, and you also co-founded an app that provides mental health matters and provides mental health assistance called Psyter that was founded in 2018. I want to take a step back in time before we jump into the interview. Tell us about your education working in the Kingdom of Saudi Arabia in the field of psychiatry.
All right, thank you very much, Ms. Lema. So basically, after doing med school at King Saud University, I specialized in psychiatry at the Saudi Commissions for Health Specialties. It was a joint program between the major hospitals in Riyadh at the time. So when I finished the specialty program, I went out to Vancouver and I did a subspecialty in addiction psychiatry. And it was a nice 2 years of my life. Vancouver, of course, is a very beautiful city, if you've been. And after that, I worked at the King Khalid University Hospital, which is now the medical city at King Saud University, for the past 15 years as a consultant psychiatrist. And then I went on to do an MBA, and that took me off the path where I started Psyter as a entrepreneurial kind of journey, and here I am today.
So I'm wondering, just what made you create Psyter? I mean, you had such a successful career working as a psychiatrist. Was there anything that made you think, okay, there's a gap in the market, or there's a better way to help people provide mental health?
Yeah, for sure. I mean, I've had previous experiences in Canada on e-mental health, and I was part of a couple of initiatives over there. But in my view, it was the future, really, a way to bridge the gap between people who need mental health care and the existing services. It's a way to, provide accessible mental health care. I'd like to say it, we move mental health care from waiting rooms to living rooms.
Mm-hmm. Yeah. And it gives more access to people, I imagine.
Exactly.
You get to see more patients remotely. We were talking kind of off camera, and you said that COVID created this kind of transition period in terms of mental health awareness. Tell us about that.
Correct. I mean, in the beginning, it was, of course, kind of legal gray area to do any medical care online. Mm-hmm. There was a lot of pushback or let's say resentment towards doing this kind of thing. Over time, different regulatory bodies in the United States mainly began to realize the potential value for this kind of intervention, and they started to make regulations and bylaws that apply to online healthcare in general. And when COVID came, that's when people started to work from home. People weren't allowed to go out, and there was basically, a state where people were housebound. That really provided the groundwork to make something like online mental health care really viable. Mm-hmm. And from there, of course, everything changed.
And this was, you founded it in 2018, correct?
I did. At the time, it was still, especially in Saudi, not very mainstream. But after COVID, then it started to pick up more, and today people are using it all throughout the country, all over the world. There's a number of well-known sites that provide similar care, and it's also being applied in other fields. Mental health specifically is maybe the most applicable because we can do all or most of the treatment online. We do sometimes, as doctors, prescribe medications, of course, and request lab work and maybe even do some imaging studies, but all that can be done from the laptop, right? So,
remotely.
Yeah.
You talked about it briefly, but what mental health kind of assistance does Psyter provide?
Okay, so it's a platform that connects care providers with people who need access to mental health care. So we provide all the tools that enable a care provider to create their own virtual clinic. All right. On top of that, we have a lot of assessment tools and supporting digital therapeutics that help support people in their mental health and to detect, like for early detection, and also for preventing worsening or complications of mental disorders. It's kind of a holistic approach, basically.
In terms of privacy and efficacy, how does it operate?
Okay, so that's a very good question, Ms. Lama. Of course, privacy is of utmost importance. It comes really into two domains. The privacy online as well, so where the data is stored, how it's handled, who has access to that data, whether it's session data for related to the client or medical history. Okay, and then there's digital security. So the other side of the coin is how that data is protected, how you ensure that no one can access it from for nefarious reasons, and the data is not shared or transmitted any other way. So encryption kind of things, and just general kind of basically cybersecurity stuff. So yeah.
We talked about it being in 2018 when you founded Psyter. It wasn't mainstream. You said it wasn't really mainstream to have mental health assistance through your phone, through digital world. When you were creating the app, were there any challenges that you faced?
Yeah, there were a lot of challenges. There's challenges with regards to the stigma related to mental health, of course, and how you can show that this is a way that helps address stigma and reduce stigma. Also, the digital kind of savviness of people, or who's tech savvy enough to use these kind of interventions. Now, of course, it's not a big problem with the younger generation. And then there's the challenge of communicating with stakeholders and regulatory bodies, and like the Ministry of Health or others, to basically get licensed and be able to formally, legally provide such a service.
And I want to talk to you about kind of the stigma of mental health and the perception of it, and how it's changed in the Kingdom of Saudi Arabia. You've been working in the sector for over 20 years, providing mental health within the kingdom in different cities. How have you seen the perception of mental health change when we're talking about since the beginning of your career, 20 years ago, to now?
Yeah, so a lot of work has been done in this regard. Mental health stigma exists all over the world. But in Saudi, it's quite particular, I think, because of cultural reasons, and of course that there's a stigma everywhere. It was quite an issue in the past, and over the past 30 years or so, I think there've been huge strides in improving or reducing that stigma from colleagues that I've learned from, and also more recent initiatives. So the government and the Ministry of Health and other entities are really working hard to not only provide education, but also access and ensure that the stigma is addressed in the most effective manner as well. I'll give you an example, sorry. From way back, I think it was around 2004, when I remember a young lady who was probably suffering from schizophrenia, but she never got diagnosed initially, because her family actually chained her to a pole in the yard for 7 years, due to the fear of people knowing that she had some kind of behavioral disorder or a mental illness or something like that. And it was 7 years before they finally brought her for diagnosis and care. Yeah, so
It wasn't understood. I mean, I imagine back then.
yeah, and that's something, of course, that wouldn't happen today. Back then, you had people who would go to faith healers 6, 7, 8 times before they even thought of visiting a mental health professional. Nothing wrong with visiting a faith healer. They use methods, Islamic methods for treatment that are, prescribed by the Prophet. But when you don't get the care that you need, like from the medical system, that's an issue as well. So you need to go to a doctor or a psychologist or any healthcare provider that can direct you and treat you in the way that you need, on top of visiting the faith healers as well.
But you've seen the perception of mental health kind of change in Saudi.
Of course, yeah.
What about in between generations, when we're talking about the older generation and then the newer generations, if we say Generation Z, Gen X?
Yeah. So the younger generation now is very tech savvy. They're also very enlightened with regards to what mental health issues are all about. They are more exposed to this kind of thing online. They're more willing to try out new treatment tools. And so not only has the general public perception changed, but also adoption by the younger generation or youth is gaining a lot of traction as well.
Would you say when it comes to kind of remote mental health assistance like Psyter or like the app, is it the younger generation using it, or is it more the older generation that's leaning towards it?
Interesting you say that. I mean, it's of course mostly the younger generation. It's people not very young, between 20 to 35 mostly, but even people who are older have accounts made by their children, and their children set up everything for them and help them use them. So, it's a big variety of people that we read online. Yeah.
No, but it's beautiful to see the perception of mental health changing.
Yeah.
Even the younger generation helping the older generation kind of understand it and approach it in a different way.
Correct.
Which is really good. It's change. It's good to see. I want to ask you about preventive medicine. For me, preventive medicine is something I kind of hold dear to my heart, especially when it comes to physical wellness, eating right, working out 5 days a week. Where do you stand in terms of preventive medicine and mental health?
Yeah, of course, preventive medicine is vital and very important for general health, and of course, mental health, specifically. Healthy mind, healthy life, right? So you have to have a holistic approach when it comes to prevention, and also mental health really is important to lay the groundwork for the rest of general health, in the sense that if you don't have a healthy mind, then you can't really work on the other things you mentioned, the lifestyle changes, the diet, the exercise, and all that. It all stems from being mentally sound, right? And the government right now has put a lot of effort into prevention. There's a lot more that needs to be done, especially when it comes to public health care centers and how they address prevention. But there's lots of work being done and huge strides in prevention medicine. The Kingdom has currently the largest virtual health care system in the world. So it's the virtual hospital, and that's in the Guinness Book of World Records actually, as the largest in the world. And they're doing a lot of good work as far as digital health. So we are really on track to being, at the forefront of this kind of this healthcare.
Preventive mental health, I want to ask you, what do you think of this? Do you think that you should go seek a mental health specialist, psychologist, psychiatrist when you need assistance, or should we do it in a preventive manner over weeks or years or months?
Well, there's different ways of looking at it. So there are a lot of tools that kind of, we call digital therapeutics, that kind of help you do assessment of your own condition, even before seeing an expert or a professional. Also, it wouldn't hurt to see a professional, but there are levels in between, because I understand a lot of people are reluctant to go see a mental health professional, especially because they tend to minimize their symptomatology. I'm not really that bad. I'm not really that advanced. I mean, it's something I can take care of.
Maybe it's just stress, or?
Yeah, it's stress. It's just this and stuff. And people sometimes delay that kind of intervention more than needed, all right? But there are also other steps, like even faith healers now know to identify mental health conditions, and they recommend people, you got to go see a psychiatrist, you got to go see a psychologist, and they do that now. It's changed in that sense. So maybe seeing a coach sometimes is a good first step, or it wouldn't hurt to see a psychologist if you have trouble. I think the biggest thing that kind of gives you a sense of what's going on is if there's any dysfunction or suffering. those are the kind of the alert signs that if you do feel that maybe it's affecting your studies or your ability to connect with others, or your well-being, or your functioning at work, then maybe you should go see someone. And of course, there's nothing wrong with it. Yeah.
No, there isn't. Exactly. There's nothing wrong with it.
Yeah.
Do you believe that everyone should go to therapy?
Well, I would love that, but I don't think everyone needs therapy. Some people are quite happy with the way their lives are going, and that also poses the question: does everyone get mental illness? Right. So not everyone does suffer from mental illness or have the propensity to get a mental illness. So there has to be some kind of propensity, like some kind of readiness to get a mental disorder. And then when you're exposed to stressors of different kinds, that's when mental disorder begins and starts to be symptomatic. So not everyone's going to get one.
I want to ask you, when it comes to mental illness, what role does genetics play, and what role does your atmosphere or surroundings play?
Yeah, so it's one of those things that's very multifactorial. The thing with psychiatry and psychology is that our disorders, as we like to call them, not diseases, are not very fully understood. So we understand genes that are related to development of different conditions, but we can't really put our finger on exactly how to treat them indefinitely and to get rid of the symptoms completely. So a lot of the treatments are geared around reducing symptomatology and erasing symptomatology through medications, but the risk for relapse is always there. Okay. So when it comes to the genetics, of course, by varying degrees, some disorders are highly genetic and some are less so. And then on top of that, the stressor could be, stress at work, at school, relationship stress, even positive stressors like moving to a new house, a bigger house, a nicer house, getting married, relationships, even when they're positive, that's considered stress. So people are at risk for getting anxiety and depression and things like that. Yeah.
What are some of the signs that people might experience that'll let them know that, hey, I need to see someone?
Yeah, so again, when it comes to whether I should see someone, I think it wouldn't hurt to go if you're feeling any symptoms whatsoever. But dysfunction and suffering are the two major, red lights here. So if you're feeling that you're not enjoying life, or the symptoms that you're experiencing, whether it's anxiety or low mood or inability to concentrate or not being able to sleep, if they're interfering with your regular routine or your ability to function or produce, then it's about time, I think, that one would see a professional at that point. Yeah.
I want to jump to the fun topic of work-life balance.
Okay.
So I work as a journalist, and our daily work hours are from 12 to 14 hours on a daily basis, which is kind of a normal day for us. High intensity, high stress. Before we jump into work-life balance, I want to ask you, what's the difference between a healthy level of stress and stress that will impact your physical health and your mental health?
Yeah, so here it really depends on the person's resilience. If you're resilient, then you'd be able to withstand a larger amount of stress. And that's, across the board. Everyone who gets exposed to different stressors will react differently, okay? So one of the things that we really stress on or emphasize is to improve the ability to face and endure stress, okay? And that is what we call improving resilience. It's one of the mainstay interventions that therapists work on, because it's not just about reducing symptomatology, but it's also improving the self, to be able to approach life in a more methodic, more structured manner, and also to endure stress in a better way. Yeah.
I have a bit of a personal question.
Okay.
Obviously, you're running an app, you're running a business. It's a business. I thought it's essentially like a full-time job on its own, but you're also working as a consultant psychiatrist at the same time. Do you have work-life balance?
Well, see, that's a kind of term that is thrown around a lot, work-life balance. But what does it actually mean? I mean, if you don't work hard, then you won't excel in life, right? So it's kind of a given that people have to push. They have to, they have to have grit. They have to really go the extra mile. But what really makes a difference is I like to use the term work hard. You've heard of it. Work hard, play hard. Yeah. But I add work hard, play hard, and rest hard. Okay. It's a bit of an oxymoron, but
well-rounded.
yeah. But rest hard means really rest well. Okay, so if you don't put emphasis on that recovery part of things, and then there won't be meaning to that work hard part. Okay, so if you could really get sleep, good sleep, rest, or play, connect with others, that social connection part, all those are vital to what we call balance, right?
When I look into Riyadh, there's so many youth that are moving to the city. When we talk about youth, I mean under the age of 35. And they're really hustling. I mean, they're working, some of them are working 2 jobs, some of them are working, even consultants I know are working maybe 16, 17, 18 hours a day. What advice do you have for them so they can maintain that balance of work hard, play hard, and rest hard?
Yeah, so try to put like time aside for yourself, like focus on yourself, on your needs, on connecting with others, okay? Getting adequate rest. That's really vital. I see a lot of professionals in sectors that are now really pushing forward what Saudi is achieving, right? And those people sometimes really lose track or lose sight of that side of things, and so they get overworked or burnt out quite often. And really you have to realize that if you want to achieve, if you don't put attention to those things, and then the main goal of working hard isn't gonna blossom the way it should, right? So, yeah.
I have friends that sleep 4 or 5 hours a night, and they, mashallah alayhim, they function better than anyone I've seen. And I attempted to do like a 4-hour sleep routine for a week, and by the end of the week, I was not just emotionally, I was physically like sick. My body was fatigued, I was exhausted, I was feeling nauseous and weak all the time. How much sleep does a person need, and can they operate on 4 hours, or does it depend on a person's body?
No, definitely depends on a lot of factors. Of course, genetics and also age. So with age, your requirement or need for sleep will go down. So some people, they do sleep 6 hours or 5 hours, but that's a function of aging, okay? But for the young, most people do need an 8-hour sleep window. Yeah, they need their 8 hours. Some people get by with less, 7 hours, or some people even 6 hours. But a lot of the people who say they do fine on 4 or 5 hours of sleep are actually not.
They're just in denial.
Yeah, exactly.
If they're watching this at home.
Exactly, because there are cumulative effects of sleep deprivation, and the effect on the actual genetic code, DNA, and also the risk for developing all sorts of different conditions, including cancers. Okay. Yeah.
So you recommend 8 hours?
I recommend what is adequate for that person, and usually most people fall within the 8-hour window. Yeah.
For my age group, if we're talking about between 25 to 35, how many hours would you recommend?
Yeah, about that amount. I mean, if you look at children, they need much more.
Yeah.
So
naps as well.
Yeah.
What do you think of naps?
Naps can be effective. I do a thing actually that it's kind of like a hack.
What is it?
Where I have my double espresso and then go to sleep.
No, you don't.
Yeah, I do, and I do that so that when the caffeine takes effect, I get up again. All right, so it's kind of like a little kind of hack that I do. It's a cheat code, exactly. But yeah, so the nap is effective, but it should be within reason. So I don't recommend really going into 2-hour naps in the afternoon, which a lot of people do after work. But maybe a 20, 30 minute, maybe 45 if you're really exhausted, you need to recover. Minute nap would be more than adequate.
I heard about this technique, which is the 7-minute nap. You shouldn't take more than 7 minutes during the day. You should just lay your head on the desk and just kind of rest for 7 minutes, then get up and continue working. What do you think about that?
Yeah, I mean, it makes sense. It makes sense. And naps are useful because they kind of rejuvenate you and energize you to go on with your day. But it doesn't make up for deficient sleep at night. You really have to be sleeping when the sun is down. That's when the hormonal, of course, the variation, the diurnal variation, the hormones that are related to sleep-wake cycle are at certain levels. And some people sleep really late. Even if you get a good amount of sleep, sleeping really late also has an effect on that balance, right? Growth hormone is released at a certain time of the early night, and you don't want to miss those vital timings as well. Yeah.
We have a bit of a nocturnal population in Saudi. I mean, I know I drive home, and then when I'm passing kind of by Kaft in that area, I see people lining up at coffee shops at like 1 a.m., 2 a.m.
And it's funny you say coffee shops, because one of our struggles is when people suffer from anxiety, you really don't want to go overboard with caffeine. And you know, having a bit of coffee every day or whatever it is fine. But if you have anxiety as a baseline, then you don't want to make it worse. So if you have insomnia, you don't want to drink coffee. People drinking Arabic coffee at 6, 7, 8, 9, 10 p.m. You know, is
it that strong? I thought it wasn't that strong.
It's stronger than an Americano.
Oh.
It is, but it's just the quantity. So if you're drinking a small, tiny, like a cup of Arabic coffee, it's not going to have as much as an Americano. But if you drink equal amounts, it's more caffeine, because lighter roasts have higher amounts of caffeine.
Do you drink coffee? You said you have an espresso before you nap.
I do. I have coffee every day. I actually try to avoid having coffee in the afternoon or later.
Okay.
So I usually just have it in the early morning. But I love coffee, of course.
So do I. We're telling people don't drink coffee if you have anxiety. You know,
it's like a cardiologist saying you shouldn't smoke, right?
So, on a cigarette.
Then he has a cigarette.
Exactly. What do you think of matcha, like an alternative?
Yeah, green tea and matcha lattes and all that. I mean, it's a matter of taste, right? So I do have them, but they're not really my go-to drink. No.
Espresso.
Yeah, espresso, black coffee, Americano, V60, all that weird stuff.
Intense, yeah.
No milk.
No, really?
No milk, yeah, no milk.
No, I only drink 1 drop of coffee with my milk. I mean, whole milk, essentially. I want to ask you, are there any holistic approaches people can take for treating anxiety or stress? Like, for example, if you're sitting in the office in a cubicle 8, 9 hours a day, dealing with a high stress environment, especially in Riyadh, there's a lot happening fast and huge turnover when it comes to major projects, giga projects. What is a holistic approach someone can take to dealing with high levels of stress, demand, anxiety?
Yeah, so a lot of techniques that we kind of implement and teach our clients when we do therapy are related to stress reduction and breathing techniques and things like that, relaxation. And those are things that are very, very easy to learn and implement. So you can find things like that on YouTube. Even Netflix has something where you can play a video and relax and like kind of meditate. So relaxation techniques, I think, are very effective and within a busy day. But also, exercise itself does release a lot of chemicals in the brain that relax people and help calm the nerves. So
I do want to ask you this question. So there was a period I faced where I was working in a high intensity. It was the busy season of journalism, which is almost all year round, but Ramadan we get a break. Ramadan is a bit slower. And I was having chest pains and I couldn't figure out why. It was during the time I was doing the 4-hour sleep week.
Okay.
And I was having chest pains and I got concerned and I went to the doctor. And I didn't want to do medication. I'm very natural. I don't want to go into medication unless I need it. So it's essential. And my doctor told me try running. So I used to run in high school, competitively, but I stopped. And then I went running for 2 weeks. Chest pain was gone.
Yeah.
Everything was, I felt like I was stabilized, even my mood, the way I approached situations, problem solving. I thought very clearly. I was very zen. I was very calm.
Yeah.
How does running impact your body and your mental health?
Yeah, so running, of course, triggers a cascade of changes in the body and the physiology of the human being. So from a lot of physical changes to what happens in the brain, levels of what we call catecholamines, dopamine, adrenaline, all these other chemicals. And some of those are endogenous opioids. So basically they're like taking heroin, but they're natural. They're inside the body, and they give you a sense of calm and tranquility, right? So running has an immediate calming effect after the event, and also a cumulative effect on mental health as well. So
there's the runner's high. The runner's high.
The runner's high. Yeah.
It's amazing. It's like being on a cloud.
Exactly, and that's similar to heroin, really.
It's addictive as well.
It is, yeah.
Once you start running, you can't stop.
Yeah.
There's something that I always hear, even in our family, even with friends, that you should never go to bed angry. Mm-hmm. What do you believe about that saying? What do you think about it?
It's not really possible to erase one's problems or to go to bed completely relaxed or calm and have a blank slate. There's always going to be problems and issues and things that people face. So, it would be preferable, but it's kind of wishful thinking, I think, in my view, to never go to bed angry.
Easier said than done, I think. Yeah. What about overthinkers? There's no one way to solve, I guess, overthinking, but what's an approach that you might have or recommend to patients who might overthink or overanalyze situations?
Yeah, again, people are different in their personalities. Some people are over analytical, and they by nature are overthinkers, right? If it's not causing any distress, then that's totally normal. It's just a change or difference in personalities or in demeanor or nature. However, if it is causing issues in someone's, enjoyment in life or ability to, face the world or to interact with others or to function in different ways or senses, then I think that's the time where they should get help.
Mm-hmm. You don't have to answer this question fully. You can just say yes or no. But you were speaking about different personalities and different personality traits.
Yeah.
I feel like psychologists and psychiatrists have this superpower where if they sit down with someone, they can kind of read their personality very quickly. Is that true?
Yeah, well, the short answer is no, it's not true. Okay.
Good.
But the problem is, a lot of people think it is, and that causes issues for people like me when we meet others socially.
Okay.
Right?
What do you mean?
I avoid saying, I say I'm a plastic surgeon, right? So, people think that if you sit with them, you're gonna read their mind and learn all their darkest secrets.
And like their actual emotions and the way they sit and everything.
Yeah, I mean, with experience, you do have a little bit of an acumen to picking up certain things. Okay, whether it's demeanors or behaviors or small tiny signs that would indicate something or the other. But keep in mind, when you meet people socially, they don't really open up to you. Everyone has a facade. They have a kind of mask on, and people are very careful to keep that mask up. So the difference when you see a professional is that you go there asking for help. So you really have to put your guard down and open up and really express what's going on. And that makes it easier for the professional to understand what's going on and what you're experiencing and to help you best. And that's the difference. Yeah.
Oh, I agree.
Mm-hmm.
I like that you said you're a plastic surgeon. It's funny. I always worry when I tell people I'm a journalist, even casual conversations, they're like, oh, off record. And I'm like, no, it's not that exciting. And it's a normal conversation. So. As a psychiatrist that's been working in the sector in the kingdom for 20 years, just on a global level from your experience, because you've studied abroad as well and you've worked abroad, what are the most common mental health cases or diagnoses that you've seen worldwide?
Okay, so without going into the stats, most commonly it's anxiety conditions, depression, insomnia, and things related to stress. So that's pretty much most of what people face. But then there are a lot of other conditions that are less common. So, for example, psychotic disorders, the most commonly known schizophrenia, bipolar disorder, which is usually around 2.5% of the population. Then you have substance use disorders as well, and OCD is a famous one, obsessive compulsive disorder, and a lot of other things. But what we see day to day is usually anxiety and depression and insomnia. They're all interconnected. So people who have anxiety a lot of times have depression, vice versa, and the sleep condition as well is related to that kind of presentation. The difference, though, in the government sector is we see more acute cases. So we have an admission unit, and the admission is made up of very severe depression cases, but also the very severe psychotic disorders, and also the cases of bipolar or schizophrenia. So those kind of things. But that's a certain setting.
Mm-hmm. Mm-hmm. There obviously isn't a cure-all, but how do you approach treating depression, for example?
Mm-hmm. So prevention is the best cure, really. So if you can build resilience, improve general health when it comes to like lifestyle measures, getting adequate sleep, dealing better with stress, healthy diet, all that kind of stuff. But then when depression begins to actually start, it's important to get early detection, basically. So to get an idea of what's happening before it progresses into a full-blown depression, because as you know, depression can become very severe. And people who are depressed, they see the world with dark-colored glasses, and so they're very negative, and they don't even realize that they're viewing things in that really negative manner. And sometimes it's kind of too late to get them to understand that they're going through this, and so we have to take different approaches, right? So it's always best to get early intervention in these kind of cases, and if the case has progressed to a far enough level, then once it's treated, then the main goal is to prevent relapse, so that it doesn't happen again.
And when you say early, I think you said early detection, early treatment. What does that entail exactly for depression?
Right, for depression, it depends on the severity. Okay, so if it's something that's caused by a specific stressor that we can identify, like someone's going through issues at work, and so it's not necessarily depression. It could be just what we call adjustment. Okay, so adjustment really doesn't need intervention, because if the stressor disappears, then the symptoms disappear. All right, so we can do therapy for that. You can help them with support and things like that. But when you actually have depression clinically, then at that point it depends on severity. So if it's a mild condition, you can do psychotherapy. But if it's moderate to severe, then you usually need medications, and you can also add psychotherapy to that. And for some cases, what we call treatment-resistant depression, you might need other kind of interventions, like medications that are more restricted, or even treatments like electroconvulsive shock therapy.
Mm-hmm. We talked about shock therapy. There was a myth you busted when we talked previously. I thought, we see shock therapy and we see what we see in the movies, where it's like a helmet or something intense shocking the person. What is shock therapy in reality?
Yes, so basically it's just applying a current to the brain to kind of make a change in the polarization of the brain cells, and it's done under full general anesthesia. So the patient doesn't feel anything. They're under full anesthesia, so no pain. The muscles are completely relaxed under the anesthesia. It's a very safe, intervention, and very effective, and even used for pregnant women as well. So when you want to avoid giving medications, or you want a quick response, then ECT is indicated for pregnant women. So that's kind of a myth that it's dangerous. Of course, we have to blame the movies, Hollywood and whatever, for that. But it's quite an effective therapy.
I want to ask you kind of a two-sided question. Having worked in the kingdom for so many years, where are we excelling in mental health? And then where are areas that we still need more improvement on?
So we're really excelling with the caliber of professionals that the kingdom basically graduates, whether locally or through scholarships abroad. We have people with intense training and very specific subspecialties who are doing great work now in research and clinical care. But I think there's only so much you can do. There's a big need for healthcare professionals, and it's hard to really satisfy the need that a growing population like the Saudi population needs. If I'll give you an example, we have historically 0.5 psychiatrists per 100,000 population in Saudi, compared to 10 or 12 psychiatrists per 100,000 in countries like Canada or other Western countries. I think now we're a bit higher, maybe over 1 or so per 100,000, but still, the need's great, and we do need more work on developing local programs and graduating more professionals here and abroad. But I think that's where interventions like digital therapeutics can play a role, or online mental health treatment. It's a way to bridge the gap and provide care on a greater scale to more people, and especially things that support face-to-face therapy. So digital therapeutics that can be deployed in between sessions to provide support to people who need mental health care can really help in a number of ways. So to support treatment in between sessions, but also to pick up early signs of change in the condition, so early detection and intervention. So a number of ways, I think. Yeah.
We haven't talked about Psyter, the app you created, enough. So walk me through it. If someone downloads it from the App Store, opens the app, what do they initially see, and what are the steps from there?
Yeah, so initially they would be asked to create a quick profile and answer a questionnaire. So the questionnaire is an assessment tool that pretty much kind of judges or measures the level of depression and anxiety that person might be experiencing. And based on the score of the anxiety and depression score, they would then, and the severity of their condition, they would then be referred to either a psychologist or a psychiatrist to get treatment. And so from there, they would see a list of the care providers that are available. So that being said, they don't necessarily have to see those two job functions. So they can see psychologists, they can see psychiatrists, they can see social workers, and they can see coaches as well. So we have all those 4 functions on the app.
Mm. And when would they know whether to see a psychologist or a psychiatrist?
Yeah, so the app helps with that through like decision trees and workflows. But again, psychiatrists generally they diagnose mental health conditions by excluding other disorders. So anxiety or depression can be caused by thyroid disease. It can be caused by all sorts of other medical conditions. So you have to exclude something else as a causative factor, and then diagnose the condition, whether it's depression, anxiety, or what have you. And after that, psychiatrists generally prescribe medications. Some psychiatrists do therapy as well, but we're more biologically oriented in treatment. Whereas a therapist would focus more on doing like talk therapy, okay, in different kinds or formats. So cognitive behavioral therapy, CBT, interpersonal therapy, psychodynamic psychotherapy. There's also a lot of other kinds of therapy.
And what are some of the areas that the mental health specialist, psychologist, psychiatrist specialize in the app?
Yeah, so all sorts of things. We have people with backgrounds or experience in addiction treatment, mood disorders, sleep disorders, psychotic disorders. A big one is personality disorders, so borderline personality disorder. A lot of people who suffer from this condition have interpersonal difficulties and relationship issues related to previous experiences and development. So we have people who provide what we call dialectical behavioral therapy, which is a mindfulness-based therapy directed to these people who suffer from these personality disorders.
And you're on there as well. You're one of the specialists on there.
I am. I have to really support the team, right? So, and also developing an app requires a lot of minor changes and pivoting and the functions and the workflows. So I have to experience all the features on a daily basis as well. So yeah.
And what goes into selecting the clinical specialists that are on there? How did you choose them?
Yeah, so basically they have to be licensed by the Saudi Commission, okay? And the Saudi Commission, when it comes to psychiatrists, licenses someone who's completed a board training and they have their board specialty or board exam, and that's what we call board certified, or that's a senior registrar according to the Saudi Commission, or consultant. And so those are the 2 functions that we allow. And for psychologists, it's there's bachelor's and there's a master's level or a senior level, which is basically PhD. Those are the three positions. And depending on their degrees and experience, they're accepted on the app. So, it's the minimum is to have the degree and the experience, but then they're selected, depending on how much experience they have and what kind of experience and things like that. Yeah.
I'm going to jump off topic a little bit. This question just came to mind. We talked about preventive intervention.
Yeah.
When it comes to, I guess, marriage counseling or relationship counseling, do you believe that preventive intervention is beneficial, or should they go when there's issues in the relationship?
No, for sure. I mean, it wouldn't hurt to do couples counseling or marital counseling, even if there aren't any issues, right? Because there's always a benefit there. But for sure, for people who have strained relationships, it's important to get that kind of help, because if you don't, then you might reach a level where it's what we call emotional divorce. So basically, they're living together, but there really isn't a life together, right? And that's not a happy place to be. And even if people don't get separated, then it's not a healthy relationship. So that could be prevented if the couple are more proactive and try to get help earlier on. Yeah.
Have you seen that? Is it very common to see preventive, I guess, counseling in relationships or marital counseling?
Not really, because again, people tend to wait until, I don't know what the term is, the best term here is, but until things get really bad.
Mm-hmm.
Right?
When the light goes on in the car,
exactly,
change the battery.
Exactly, and that's when they do the oil change or the battery change and stuff like that. For preventative maintenance, people don't really think that way. I wish people would, maybe see a professional just to make sure everything's okay. There's nothing wrong with that.
Yeah.
Mm-hmm.
Yeah, exactly.
Yeah.
I have kind of a personal question. What drives you in your career and your work?
Yeah, so I guess just having that grit or drive to achieve something that helps people the most. So to provide value. I think that's what drives me the most. I enjoy the work that I do, the mental health field itself. I also enjoy the business entrepreneurial side of things as well. So mixing that together for me is just the perfect kind of balance between two fields. And I think what maybe helped me excel is in my work initially is having empathy, being able to listen and to care. People, when they feel heard, listened to, that's a big part of the treatment, before you even talk about actual treatment. Mm-hmm. Yeah.
This is just a question off the top of my head. You've been working in the sector for 20 years. Mm-hmm. Have you seen rates of empathy in people increase or decrease or stay the same in the last 20 years?
Well, it's really hard to say. I think, off the top of my head, I'd imagine that with technology and all these digital, media tools that we have, social media and whatnot, I think maybe people as a society tend to be less empathic. But that's just something that I sense. You can't really say something like that without studies to prove it, right? Yeah.
But something you've just experienced, I guess. Yeah.
Mm-hmm. Mm-hmm.
Well, there's a way we like to end every episode of the discussions of the podcast. As a consultant psychiatrist working in the sector for 20 years, as a co-founder of a mental health application, what advice would you give someone wanting to pursue a career in your sector or industry?
Yeah, again, I would go back to the same point of empathy. I think if you really demonstrate powerful empathy with all your clients or people you deal with, then that's the basis or the groundwork that you need to excel at this field. But then on top of that, to be open to novel things in the field. So all the disruptive technologies and the tools that you can make use of to best approach mental health conditions. So if you can mix those two things, the empathy on one hand and on the other hand, technology and novel approaches, then you're really set to excel. Yeah. Mm-hmm. Mm-hmm.
And the whole idea of discussions is we want to make social impacts. We want to educate, spread a positive impact any way we can. So it's a bit of a call to action, but mm-hmm. What's one simple action anyone can take to make a positive impact, whether it's small or large?
Yeah, I think we talked about this before, but even a simple thing like just a smile, to connect with others, lend a listening ear, make people feel heard and listened to. I think just that emotional connection or touch is the starting point where people can, if they need, get the help they need, whether it's mental health care or otherwise. People maybe don't see the significance of what they can do by just listening.
Yeah, I completely agree.
Yeah.
I think it's a wonderful way to end the episode. Thank you so much, Dr. Majid. I really appreciate your time.
Thank you. I appreciate it.
This was a good conversation. I learned a lot. It was really helpful.
Yeah. Great. I'm glad.
And it was fun. The time passed by very quickly.
Yeah, I was surprised when you said it was the last question. So I was like, oh, really? That fast?